Hi, I'm Tammy Potter, and welcome to the Pregnancy Process Podcast, a show designed to help you navigate the hugely transformative journey to motherhood, where you'll hear the unique experience of experts in this area and the incredible stories of women sharing their conception, pregnancy, and postnatal journeys so that you can have a healthier, more informed pregnancy. In today's episode, I talk to specialist women's health physiotherapist and founder of the Pelvic Studio, Jaclyn Thurley. Jaclyn holds a pelvic floor and continence postgraduate degree from Melbourne University and a master's degree in clinical physiotherapy from Curtin University, where she majored in women's and men's pelvic health. She is a titled APA Continence and Pelvic Health Physiotherapist, specialising in pelvic floor, bladder and bowel dysfunction, sexual dysfunction, lower back and pelvic girdle pain, and abdominal rehabilitation. In this episode, we're going to be discussing all things C-section, from why this widely practiced delivery method is somehow still surrounded by stereotypes and prejudice, to the importance of informed decision-making, postnatal rehab, wound care, and how you can improve your overall C-section experience. Jaclyn, thank you so much for your time today. It's fantastic to have you here with us.
Thanks for having me, Tammy.
I am super excited for this conversation and to talk all things C-section. And I tell you what, in the making of the Pregnancy Process program, there was a little fun, let's call it a fun fact that I absolutely loved. I don't know if it's a fact, but I learned something that I absolutely loved about C-sections, in that in the British Empire, the very first person to actually perform a C-section was a woman masquerading as a man, because way back then women weren't even allowed to practice medicine. So from that perspective, I mean, we have come such a long way. And even way back then, the C-section was performed to save a child's soul, not even its life, and typically resulted in both the death of the mother and the baby. And we've come such a long way in so many ways. But even with how far we've come from way back then, where women were having to masquerade as men to even perform medicine, but even how far we've come, the C-section still gets a bit of a bad rep, I feel. And from your professional and personal experience, can we talk about how women having C-sections can actually ensure their birth is a more positive, empowering one?
I think you're exactly right. I still think C-sections get a bad rep, more than what they probably deserve with how safe they are. And I think a lot of that is a misconception or misinformation in regards to C-sections, the pros and the cons, and how that might actually be the better option for a woman and a safer option for bub sometimes. So I think for cesareans to lose their bad rep, I think women and their surrounding communities just need to have more knowledge about birth choices and the pros and cons of the different modes of delivery, and when a particular mode might be a better option over a vaginal delivery. And I think to have an empowering birth, part of it is knowledge. So if you understand the pros and cons of the cesarean, if you understand the procedure, so you know what to expect, so that you can know how to personalize it as well. So with a cesarean, adding your own playlist of music, essential oils if you're allowed, outlining to your antenatal team the kind of vibes you want for your birth, outlining the role of your birth partner, and also having an understanding of what to expect afterwards, I think will help to make a cesarean a more positive, empowering experience. But it's definitely, I think, the community that you're surrounded by, I think, needs to support and be positive about your cesarean experience as well. And I speak for my patients in that regard, and also personally. There is a lot of, I can't say this word very well, prejudice around cesareans. And I think that needs to change, and we need to support each other and our choices.
Absolutely. I mean, even just in relation to that specific point, because there's definitely some links in there that we'll explore, but specifically around the community and the prejudice around that. I spoke to someone recently and they were having a C-section for pregnancy complications reasons, similar to yours, I think, in that this particular woman had preeclampsia. So even for her, when there were pregnancy complications that really indicated having a C-section, she struggled with it and even had people questioning her decision. And this is external people questioning her decision and whether or not her daughter, because her daughter was born with complications, whether or not her choice to have a C-section actually impacted her daughter and the complications that she was born with. But at the same time, wouldn't these people just be trying to support her rather than second guess? And there's that whole thing, too posh to push.
All that kind of stereotyping, that too posh to push and that kind of thing. Yeah, it's still definitely a bit of an issue.
So in terms of knowledge being key, if you could have a blue sky education around C-section, what would that look like?
Well, I think first of all, understanding the pros and cons. So, in terms of the pros, so obviously in an ideal scenario, it would be great to have a uncomplicated, smooth vaginal delivery where your labor progresses beautifully, bub is in the right position and passes through the pelvis and through the birth canal and exits with minimal trauma to the pelvic floor and minimal tearing and things like that. Obviously, that is the ideal scenario. But these days, we can identify risk factors which may indicate that that ideal vaginal delivery may be less likely. And so I suppose understanding that you can have an individual assessment looking at risk factors and working out whether a cesarean is a better option to a potentially long, difficult, instrumental delivery. So I think understanding the pros and cons to a vaginal delivery, a difficult vaginal delivery, and a cesarean, and the benefits to you and your pelvic floor. And so if there are risk factors, a great alternative is a cesarean. It has its pros and cons, but compared to a difficult, long obstructed labor, cesarean would, for most women, may be the preference. It depends on people's belief systems. Like some women are so internally motivated, they really want to have that vaginal delivery. And so we want to support those women and we want to reduce the risk factors that we can reduce and control and help them achieve the vaginal birth that they want. Whereas some women are in the middle, or some women are quite open to a cesarean. So once they're given all this information and potentially if risk factors have been identified, they may be quite open to exploring a cesarean. So I think if more women understand that they have options and understand the pros and cons to each option and how cesareans are, incredibly safe these days, and the impacts on bub they need to understand as well. And I think there's some misconceptions around that as well, but that's really up to speaking in depth with your antenatal team in regards to that. That's not quite my area of expertise, but I think really understanding the different modes of delivery, the pros and cons, and in particular, the individual risk factors that you have that may indicate whether you will have a difficult vaginal delivery or not may help you make a decision, an empowered decision to go that cesarean route.
So when it comes to your area of expertise and risk factors, can we talk about things like when it comes to the structure of the pelvis and the pelvic floor, what kind of reasons surrounding these areas would a C-section potentially be recommended?
Yeah, exactly. So we as pelvic floor physios never recommend a particular mode of delivery, but what we do is we collect factual information for the patient, and we relay it to the patient and their antenatal team if needed. And that can help to get a discussion happening in regards to the best mode of delivery. So things that information we might collect. Let's start with when we have a chat to the patient. We might be asking them, do they have a family history of urinary incontinence with their mum, their sister, their auntie? Or do they have a family history of prolapse, their mum, their grandmother, their sister? Does their father have a history of hernias and hernia repairs? So we're getting an idea of their collagen and that kind of thing. And we have really good research to show that if you have a strong family history of urinary incontinence or prolapse, that it is likely that you will probably have a similar experience as your mother and sister. And so we take that into consideration when we look at the pelvic floor and things like that. So the other things that we look at in our appointment that may be really useful information for a woman is their pelvic floor. So when we do an internal examination, we take some measurements around the vulva, and that gives us an idea of the resting tone of the pelvic floor and the connective tissues. So we're looking to see, does a woman have greater resting tone, or does a woman have more laxity? We're also looking at flexibility in the pelvic floor. So we get the patient at different stages, usually at about kind of 21 to 24 weeks, and then again a few months later, leading into their third trimester, we get them to gently bear down. And again, we take measurements of their pelvic floor, looking at the flexibility. And so we can compare that to normative data. And if things are looking a little bit tighter down there is lots we can do to fix it, but it's also useful information for the patient and their antenatal team to know, because that in combination with a big bub or quite a complex family history of prolapse and urinary incontinence, maybe bubs in a funny position, maybe the patient's preference is, I don't need that natural experience. I just want to get back into my HIIT training and I want to be running marathons and that's my priority. It may spark that conversation about their mode of delivery.
So in terms of the pelvis, the structure of the pelvis itself,
Yeah.
are there any kind of things that you might look out for from the actual structure of the pelvis, like the bony structure of it? Is that your area of expertise or?
The thing is, like in a general sense, yes. So say you've got an Indian woman or an Asian woman with a very small pelvis and their European husband who's 6'4" and bub's looking to be really, really big and they've got this tiny pelvis, then yes, you may put that into consideration. But from the outside, how wide your pelvis is may not correlate with how wide your pelvic inlet and outlet is, because women can have different shapes of their pelvis internally. So externally, they might look like they've got very narrow hips, but they've also got a really nice wide pelvic outlet and inlet. Or vice versa, they might have nice wide hips, but it's different on the inside. So we don't have enough research to show that that is connected or correlated, if that makes sense.
So I didn't actually realize that there was a strong family history around prolapse. So that's super interesting. So in terms of that and incontinence and bladder issues, seeing we're kind of already talking about that, I feel like lots of people, especially women, are really unaware that C-section deliveries can also have urinary incontinence and bladder issues. Can we talk about that a little bit?
Yes, definitely. I think it's a misconception that if you have a cesarean, you won't have any issues with bladder leakage. So from the research, it shows that cesareans are protective of urinary incontinence in the early stages. So I think it's the first 18 months or so. So in terms of the rates of incontinence early on, they're less in cesarean versus vaginal delivery. But if you look at the longer term follow-up, So 4 and 12 years, there's absolutely no difference in the rates of incontinence in women that have had cesareans versus vaginal delivery, which everyone was so surprised about. It's like, what is this? This is interesting. And I think we put it down to the changes that occur in pregnancy and lifestyle factors, constipation, for instance, and then other things like menopause. But cesareans are protective of prolapse. So that's why sometimes if someone has quite a strong history, potentially their mother, their grandmother, their sister, their auntie have all had prolapse issues, needing surgery, etc., then they might explore the option of a cesarean.
Well, that's really interesting. And part of me really wants to talk about the whole lifestyle factors, menopause, the effect of pregnancy on the pelvic floor, because I could so go down a rabbit hole with all of that when it comes to the pelvic floor. But that's so interesting, isn't it? That I feel like people really do believe, and I'm pro C-section, so like I'm not anti it. I like how I'm neutral, should I say? I think it's so dependent on the situation and the person, and it really should be an individual decision because there's so many factors, even from a mental health factor. So for someone that suffers quite high anxiety, the thought of not even knowing when they're going into labor, having anxiety around the birth, I feel like from even that perspective, the option of C-section where they know exactly when they're going to give birth, they can plan around it, they can plan what that's going to look like for them, they can feel that sense of safety around that helps with the mental health side of things. And I think that then helps them how they enter motherhood. So now I've lost my train of thought, but I guess what I'm trying to say is I'm neutral in C-section, and I think it's really interesting how so many people think that it's going to protect them from incontinence and that type of thing, but really it's more protective of prolapse than it is of bladder issues and urinary continence later in life, and that it's like that type of thing is so much more lifestyle factor driven. And that's the type of thing that we also need to be educating women around their pelvic floor. And it's that there are going to be issues in muscle atrophy in menopause. There are going to be lifestyle factors that we can work on surrounding our, I guess, toilet habits and all types of other factors. The way that we train, the type of training that we do, how we breathe when we train, whether we use belts or not when we train, all of these types of things go hand in hand with that educating around the pelvic floor. And it's not just, hey, I'm going to protect my pelvic floor by having a C-section. I think that's really a key factor in all of that. And I know that was a really long-winded answer. But I think we'll leave that point there. Otherwise, I'll talk about it for ages. So C-sections, right? Let's talk about, because I get so many questions about the C-section pooch. From an aesthetic perspective, the scar tends to disappear quite nicely, and you can do things like laser on the scar, and we'll talk about how we can care for the wound in a little bit. But I get so many questions around the C-section pooch. And for people that don't know what I'm talking about, it's when you get that little overhang that kind of goes over the scar. And you can correct me if I'm wrong there. But how much of this is actually about the surgery itself? And how much of this relates to things like weaker lower abdominals and incorrect muscle activation pattern? Because I think so much of the abdominal cavity and what it looks like from an aesthetic factor and how it functions from an internal factor comes back to how all of those muscles work together and their strength. So can we talk about that in a little bit more detail?
Absolutely. I think it depends on the woman. There can be different kind of contributing factors to the pooch. Mm-hmm. Is that what you call it?
Yeah. The pooch, the pouch.
I got one as well. So when I had my cesarean for my little baby girl, I got a pouch. And I would say the majority, it's caused more by swelling and increased fluid around the scar, often above the scar. So you get this puffy area that kind of protrudes over the scar. And so the majority of women, it's probably fluid and a bit of swelling. And I get a lot of patients quite alarmed by it, and often it completely resolves. So when they do the incision, I think they cut through about 7 layers of skin and fascia and eventually the uterine wall. Now, when they do that incision, it can disrupt lymph flow. So your little lymphatics that deal with fluid. And so you can get this buildup of fluid that eventually will dissipate. What you can do is, when appropriate, start to do some gentle massage around the area, encouraging that extra fluid to go back to the groin lymph nodes and then back into the system. Other times, the pouch can be caused by excess skin and adipose tissue, so fatty adipose tissue. And whether this is worse because you've had a cesarean versus would it be any different if you had a vaginal delivery, I'm not too sure. Potentially because of the incision, and sometimes that scar is quite stiff, it might make it a little bit more noticeable initially. But in that instance where it is potentially more loose skin, adipose tissue, and potentially a bit of weakness in the muscles, that getting the right activation patterns happening, getting those abdominal muscles working when appropriate will help more with that versus the fluid, which is more doing massage and effleurage to get rid of some of that buildup of fluid. So it varies.
Right.
It
So
varies.
it's a little bit more individual, like everything to do with pregnancy and postnatal. It's so individual, right? Everybody's so different. So let's talk a little bit about wound care. So you've mentioned already that post-surgery you can have swelling around the wound, you can have fluid around it, the scar can be a little bit stiff. And I mean, there's plenty of studies that show, I think one study showed that I think it was 63% of women who had an emergency C-section and 59% of women who had an elective reported wound pain. So why would this be, and how can we change that?
Those numbers are really surprising and incredibly high. I think the factors, again, for their wound pain varies depending on the individual. When the incision is done, when they cut through the skin and the layers, they may cut through little tiny cutaneous nerves, which can make the area numb. Or sometimes, as those nerves regenerate, those nerves can be a bit more sensitive. It might be a bit itchy, a bit burny. So that can add to sensitivity or those nerves kind of regenerating. And then the other thing can be hormonal factors, also psychosocial factors. So, for instance, if you didn't want a cesarean and you were pushing for hours and hours and then you had to have an emergency cesarean and you didn't want one, that can make your nervous system a lot more sensitized and not very tolerant of your scar. And that can make things more sensitive as well. And then as the scar starts to heal, the collagen that gets laid down is often quite stiff. And so if that area is stiffer, that can also make it more sensitive. And then on top of that, you're caring for a little bub. So you can't always take it easy. You have to lift, often in awkward positions, and that can put a bit more strain on the incision side. So there's a few factors at play in terms of incision discomfort, but I think not enough women probably do the appropriate amount of wound care and gentle massage around the area to help desensitize those nerves, to help soften the scar tissue, and to, in that instance where you didn't want that cesarean and that might be playing into the sensitivity of the scar, massaging that area is a way of gently accepting that it's there. So that can also help with that side of things.
Do you have any other, I guess, tips, I would say, for caring for it? Because you've mentioned massage. What other things would you recommend?
So usually we like to see patients throughout their pregnancy. So if we are knowing that you're going to have a cesarean, we have the luxury of talking about all these things in advance. And one thing that we will discuss is silicone scar sheets that you can place over the scar. You talk to your antenatal team and get guidance on when you can start using these, but they can really help with the scar healing and help with desensitization and that kind of thing. The other thing that we will often talk about is compression garments as well. Wearing them as soon as comfortable. So you may not want anything pressing on your scar for the first couple of days, but as soon as it feels comfortable, trying a compression garment, something simple like elastic tubie grip, abdominal tubie grip, very cheap, and they often give it out in hospital, and that can feel so beautiful and give you that little bit of compression and support to allow you to move more comfortably, because it's very important to get you up and moving comfortably to reduce risk of DVTs and that kind of thing. So tubie grip's nice. And then once you're comfortable enough, trying something a little bit more heavy duty like your SRC compression shorts or leggings or whatnot, and they actually have quite a tough seam just at the level of your cesarean scar, and I love that, and a lot of my patients love that because it just gives you that extra bit of support. But if your scar is very sensitive, you might not like having a seam at that level. Same thing with your undies. You may need to wear undies that are around the waist, so the seam's not near, so the waistband's not near your cesarean scar. But yeah, compression garments, your silicone gel sheets. Start your massage usually after your antenatal team has given you the all clear at your 6-week postnatal check and there's no scabs or broken skin, everything's kind of healed. You can start doing your gentle massage above and below and on the scar. And I think if more women are doing that from the get-go at that 6-week mark as appropriate, I think these rates of discomfort in the incision would be a lot lower.
I agree. And just in terms of the compression and the fact that you were talking about the C-section, we were talking about the C-section pooch, the compression would probably then help with the fluid and the swelling, right?
Yeah, exactly. And I think it depends on the compression garment, because some compression garments put a lot more pressure around the waist, and that might actually cause more fluid to collect in the lower part of the tummy. So you need to be careful with where the compression garment gives the most support. So for cesareans, and probably, for the majority of women, you want a bit more support in the lower part of the tummy. Some women might have quite a fair bit of tummy muscle separation up through here. And in that case, a compression garment that gives a lot of waist support is beautiful, but not for all. So yeah, make sure that your compression garment is giving you the support where you need it.
So waist trainers are a no then?
Absolutely.
Okay, great. So, oh gosh, I've got so many. You can see me furiously taking notes while we're talking. So I know something that's quite important and something that I bring up to any client that's coming back from a C-section, or if they're coming back to me postnatally from training during pregnancy, or they're a new client. And one thing that I also always ask them is, do they have full sensation back at their scar site? So all of these things that you're talking about are helping, because obviously that full sensation relates back to nerves and being able to connect to the muscles underneath and all that type of thing. So can we talk about why having full sensation back at the scar site is so important and what that actually means? And also, would all of these things that you've just given us some great tips on, that would help with that, right?
Yeah, exactly. Especially touching the area would be really important. But there's a difference between sensation in the skin in regards to light touch. So that's the little tiny cutaneous nerves. So if you were to brush your fingers over the area and little patches feel numb, that is not as concerning as if you just feel very disconnected from the area. So, firmer pressure feels numb, or you being able to connect with your lower tummy and your deep core muscles is really, really difficult. That awareness you definitely want to get back. But if you have patches of little bits of a light touch numbness, that's okay. Sometimes that never comes back. Sometimes you can have like a little patch that is always numb for years and years and years. That's okay. But if you're numb in the muscle area and you can't connect, then that's definitely something that we can work on and should work on, because that will impact your function.
Amazing. Thank you for clarifying that. I think that's so important.
Right.
Now, you have mentioned abdominal separation in there. And
Yes.
in terms of rehab, and we won't go too far down the abdominal separation track because I want to really focus on C-section. But I know many women do have a combination of both. So they've had a C-section delivery and then postnatally they have abdominal separation. So can we talk a little bit around what rehab for that combination of things might look like?
Yeah, exactly. So in terms of, just to clarify, in terms of cesarean impacting or causing worsening of their dram or anything like that, I don't know if there's a connection with more women that have had a cesarean having tummy muscle separation. But the fact that you need to take it easier for longer when you've had a cesarean, you're a little bit on the back foot in regards to abdominal rehab, which is really important for managing your tummy muscle separation. So often you just need to take it a little bit slower in regards to abdominal loading, not necessarily from the point of view of the incision in the skin and the incision through the linea alba, but more from the point of view of the incision through the uterine wall. So it's very important that you get advice and hopefully some specific time frame from your auntie team. If you have an obstetrician, getting some specific timeframes from them in regards to exercise and loading and that kind of thing, because there seems to be no real common consensus on when women can start doing core exercises or that kind of thing. So it is a little bit individualized, and I think that's not such a bad thing. It's just hard when you're trying to give general guidelines because it varies a lot. But depending on the doctor, it ranges from kind of 6 to 12 weeks postnatally to get back into exercise. General walks are considered safe and advised to do, but in terms of heavier core exercises, it varies. But from the point of view of a pelvic physio, we like to get you doing stuff that is comfortable and light from the get-go. So even though you've had a cesarean, if it's comfortable, it is safe to do some deep core exercises, gently drawing in that lower tummy and then letting it go. If it's comfortable, it's safe to do some pelvic tilts. In particular, I love posterior pelvic tilts to start to get lower rectus going. You can do bridges, you can do gentle upper body exercises that load the core lightly. We don't want to do nothing and then at 8 to 12 weeks get straight back into it all. We want this gradual return.
I think the key point here is but there's two key points, I think, to what you just said from my perspective. And that's, you can't leave it till 6 to 8 weeks to start doing anything. You can't just be like, oh, I'm just going to go for some walks and that'll be fine. You actually do need to start doing these things relatively soon. And that what you can do is completely individual. Because I think in this day and age where we're so connected and there's so many people on social media having babies and showing their recovery and their recovery journey, and it's so individual to where they started from. Everybody's postnatal journeys are going to be completely individual and based on where they were before they had a baby, what they did during their pregnancy in terms of exercise, how they approached it. Did they tick all the boxes in terms of going to the specialist women's health physio, understanding how to correctly activate their pelvic floor and deep core muscles? Like, did they maintain that throughout their pregnancy? What kind of birth they had and what kind of support they have on the other side in their postnatal journey? Because I think sometimes people turn to social media for answers without understanding that their journey is so individual, and they can't be looking at other people's journeys and comparing their journeys to where they are and what they can do and being like, well, if she can do that, then I can do that as well. Because it has to be so individual. And I think absolutely you really need to be under the care of your antenatal team and a specialist women's health physio in this journey. But secondly, don't leave it to 6 to 8 weeks. Understand what you can be doing from almost, you need to be preparing for that 6 to 8 to 12 week period before you have the baby.
So usually we see women at that 6-week postnatal check.
Mm-hmm.
But if we have the luxury of seeing them in their pregnancy, we know the patient intimately, and we can give them some exercises to try in that first 6 weeks and give them a bit of a pyramid scheme. Like, start here. If that's comfortable, you can go to here if that's comfortable. So it's important women know how to self-monitor and look out for signs and symptoms that what they're doing is too much, or signs and symptoms that what they're doing is perfect and they can go to a slightly harder exercise. We don't want women to fear movement. I think that is the biggest thing. And I think we've in the past, we've gone too far the other way of, don't do that, it's not safe. Don't do that, it's not safe. I think we need to give the power to the women and make them fully understand what they're looking for in terms of if something is not right for them, they need to scale back. But yeah, and not every woman has the luxury of being able to come and see a women's health physio before and after, or the luxury of having the best PT in Sydney in their corner. So, it would be really nice to try and empower women and give them as much free information as they can. But it is very individualized, and unfortunately, eyes on and hands on allows us to give a lot more individualized advice and exercise.
So in terms of that, with signs and symptoms, and thank you, I appreciate that. But signs and symptoms, what would be signs and symptoms of too much?
So a couple of things. So as we've already talked about, any pulling or discomfort at the incision site. So I generally say anything more than like a 2 or 3 out of 10 in terms of, it just doesn't feel right. It's too much. The other thing is any pain in the back, any discomfort anywhere really, hips, etc. Any bladder leakage, any feelings of heaviness or dragging at the vagina, because even though you've had a cesarean and bub hasn't passed through the birth canal, you've been pregnant for 40 weeks or however long. If you've had a cesarean, probably more like 38 weeks. But your pelvic floor has gone through a lot of changes during your pregnancy, and it doesn't snap back like that. It takes time. So we need to be conscious of any heaviness, dragging in the pelvic floor as well with any exercises that we do. And then obviously correct technique and breath pattern and all that kind of thing needs to be incorporated when deciding if an exercise is appropriate for you. And some women are better at monitoring their own technique than others. So yeah.
Amazing. So let's talk pain relief a little bit.
Yeah.
So obviously everyone's pain tolerance is going to be different, and they do provide pain relief medication. Do you have any advice around that?
I do. I would, if you had the luxury of having a planned cesarean and it's not an unexpected emergency cesarean, have a really good chat to your antenatal team and a really good chat to your anaesthetist as well, because they tend to deal with your pain meds in more detail, but get an idea of what the acceptable levels of discomfort are, especially in those first few days, because that helps to set the expectations. So I actually asked my obstetrician what is an acceptable level of discomfort. And she gave me a beautiful straight answer of nothing more than 3 out of 10. I was like, right. So that made me stay on top of the breakthrough pain medication to make sure that I was comfortable so that I could breastfeed, so that I could mobilize in the bed, get up and have a shower, and keep taking the pain meds, although they do make you constipated, which is not ideal. Keep taking them until you definitely know that you are comfortable, and then slowly wean off. So there was a couple of days where I kept taking the pain meds even though I felt pretty good, but I just didn't want to. I wanted to stay in front of the discomfort, and I felt that I ambulated a lot quicker and was moving really well because of that.
Amazing. So in terms of C-sections, I mean, it is pretty major abdominal surgery. And I could go on another rant here, but I'm going to try and keep it a little bit like succinct. But I feel like for so many other surgeries, you have full rehab protocols. You have prehab protocols, and then you have rehab protocols as well. Like, let's just say, for instance, my mum had a knee surgery, and obviously she's not having children, but my mum had knee surgery last year, and she had to do a full prehab protocol, and then she had a specific rehab protocol afterwards. I have to wonder, why is this not happening for C-sections?
Or any postnatal recovery, no matter the mode of delivery. Exactly right. So you often get a handout from your hospital pelvic physio that gives you some very gentle basic exercises. But unless you do come and see a women's health physio and see them a handful of times to get progressions, you are out on your own. Whereas in France, for instance, the government pays for 5 sessions with a pelvic physio so that you can rehabilitate yourself appropriately. So I feel like there's a lot of room to improve in this space. And the biggest limiting factor is the fact that things need to be so individualized, as we've been discussing. But it would be good to potentially have some stages of examples of some exercises at different stages that women can have access to, because potentially that's better than nothing. But yeah, there's a lot of room to be done in this space.
I totally agree, which is, I guess, why it's important to have these kinds of conversations and try and get as much information and education out in this space as well, which really ties back to our start point, which was that the surrounding community who support the women who is having the C-section, it's so important that they are educated, because the more that the woman is educated on the pros and cons of cesarean, the more that her surrounding community is educated, the more supported she's going to be. And then on top of that, the better her pre, during, and post journey is going to be. But I just wish, I personally, I feel that access to the specialist women's health physio should be covered by Medicare, like 100%. And the fact that postnatally it's not there yet, I know people are absolutely out there advocating for it, but in the meantime, until that happens, conversations like this are so important, and getting as much information out there to women to make sure that they are training correctly, that they're being encouraged to get to the specialist women's health physio if they can, because you're right, not everyone can do it. So before we sign off, I've got one more question for you, but is there any advice that you have for women who maybe can't get to a specialist women's health physio? Just some small tips or things that they can do to make sure that they have, or even some knowledge that you can share for them to help them with their surrounding community to make sure that they do have that more empowered experience?
First of all, When you're meeting with your antenatal team, ask as many questions as you can and write down the information and relay that information to your community so they are just as informed as you are. In terms of self-managing your rehab during your pregnancy and postnatally, there are a lot of great resources online. The Continence Foundation is a great website that has some very basic exercises that you can start to do, such as mobility exercises, pelvic floor and deep core exercises and that kind of thing. And just know that exercise and movement is crucial and important, and don't fear it. What feels good is good. If it doesn't feel good, it's a bit too much for now, back it off. And yeah, be kind to yourself and to all women. Support women that are making choices about their birth. Do nothing but support them. Don't judge, just support and provide love and encouragement.
So my last question would be, if you had, let me rephrase that. What would be the one thing, either from your personal experience or your professional experience, what's the one thing you wish all women knew before they had a baby?
Oh, God. The one thing I wish women knew before they had a baby.
And it can be anything. It can be something that you've learned that you were like, because obviously you're very well versed, but is there anything that you can like look back on your pregnancy experience and being like, oh God, I wish I knew that before. It could be pregnancy, birth, having a baby, being a mum.
Oh. Okay. I would say don't try and do it all. Try and involve as many people as you can and create a village to share the load of having a baby.
I think that's really good advice. And you know what? I feel like I have heard this before. And I remember one of the guests on the podcast who was suffering from mental health and sleep deprivation, she said exactly the same thing. So it is so important to make support is so important. And I was having a conversation just recently with a single mom, and she said, I never realized how much support I was going to need from other people. Like, she's quite a self-sufficient person in herself. And I think that's a trap I think some women get into, is that they feel like they need to be self-sufficient and do it all. But you're so right.
Yeah. With cesareans in particular, you may be a bit sore for the first 6 weeks. So you really want to get as many hands around you as possible to share the load. It's always good to kind of plan for the worst, hope for the best. You might find that you recover so quickly and have hardly any discomfort or any limitations with your function. But just in case, just make sure you've got your village if you can. And if you don't have a village, then if you could, some paid help is always good in that first 6 weeks as well.
Amazing, Jack. Thank you so much for your time today. It's been so wonderful to see your face, and I really appreciate you taking the time to talk to me today. And if you're hearing this message, I want to say a huge thank you, because it means that you've listened to this entire episode. Of course, if you have any questions about the things that we covered in this episode, or want to know more about me or my other projects, you can find me on YouTube and Instagram at The Pregnancy Process. For those currently in their conception or pregnancy journey, you can apply to join my complimentary but private community, the Preggy Training Crew. And you'll find my community application and social media links in the episode description. And of course, if you enjoyed this episode, I absolutely encourage you to share it with other women just like you. And I look forward to seeing you in the next episode.